In a world filled of desire, forget of tortillas, forget of Rosa, but never forget of Arnold Schwarzenegger. I am back. In a world filled of pollution, people struggle to survive. Now Arnold Schwarzenegger will do something about it. Stop smoking if you want to live!
We interrupt this program to bring you a special newscast. Good evening, America, and boy, do I have a show for you today. I'm here with special guest Arnold Schwarzenegger and his scientist friend Diego Rodriguez to tell us a little bit about lung disease and the obvious fatal causes of it. Now, Arnold Schwarzenegger, what do you have to say? Thank you, Mr. Reporter Person, and good evening to you, Californians. I will now let my scientist friend Diego Rodriguez to tell us more of lung disease and the fatal things that smoking does to your lungs, Thanks, Mr. Schwarzenegger, sir. Anyway, I'm here to talk about 6 different lung diseases that are very serious and are the following. Now let's see. Bronchitis, asthma, pneumonia, pulmonary tuberculosis, lung cancer, and emphysema. Now let's begin, shall we? Let's begin with bronchitis. Now, bronchitis is an inflammation of the bronchi, which are the medium-sized airways in the lungs. There are 2 types of bronchitis, acute bronchitis and chronic bronchitis. Now, let's start with chronic bronchitis. Now, chronic bronchitis isn't not necessarily caused by infection and is generally a part of a syndrome called chronic obstructive pulmonary disease, otherwise known as COPD. It is defined clinically as a persistent cough that produces sputum or phlegm and mucus for at least 3 months in 2 consecutive years. Now let's move on to acute bronchitis. Now, acute bronchitis is characterized by cough and sputum, which is phlegm, as I told you, in production and symptoms related to the obstruction of the airways by the inflamed airways and the phlegm, such as shortness of breath and wheezing. Diagnosis is by clinical examination and sometimes microbiological examination of the phlegm. Now let's move on to asthma. Asthma is a chronic condition generally associated with humans, but also controversially being diagnosed in house pests such as cats. So if you have a cat, it might have asthma. So check it out. Anyway, asthma involves the respiratory system in which the airway occasionally becomes inflamed and is lined with excessive amounts of mucus, often in response to one or more triggers. These episodes may be triggered by such things as exposure to an environmental stimulant or allergen, such as cold air, warm air, perfume, moist air, exercise or exertion, or emotional stress. In children, the most common triggers are viral illnesses, such as those that cause the common cold. The common cold, can you believe this? Anyway, now let's move on to pulmonary tuberculosis. Tuberculosis is a common and deadly infectious disease caused by mycobacteria, mainly Mycobacterium tuberculosis. Tuberculosis most commonly attacks the lungs, but can also affect the central nervous system, the lymphatic system, the circulatory system, the genitourinary system, bones, joints, and even the skin. Other mycobacteria, such as Mycobacterium bovis, Mycobacterium africanum, Mycobacterium cannati, and Mycobacterium microti, can also cause tuberculosis, but these species do not usually infect healthy adults. So, if you're a healthy adult, you're free. Anyway, let's move on here to pneumonia. Hey, I was just thinking about it. Pneumonia is an inflammatory illness such as of the lung. Sorry there. Frequently, it is described as lung parenchyma, alveolar inflammation, and abnormal alveolar filling with fluid. Now, pneumonia can result from a variety of causes, including infection with bacteria, viruses, fungi, or parasites, and chemical or physical injury to the lungs. Its cause may also be officially described as idiopathic, that is, unknown, when infectious causes have been excluded. Now let's move on to lung cancer, which is the last of our lung diseases. Now, lung cancer is a disease of uncontrolled cell growth in tissues of the lung. This growth may lead to metastasis, invasion of adjacent tissue, and infiltration beyond the lungs. Now, the vast majority of primary lung cancers are carcinomas of the lung derived from epithelial cells. Lung cancer, the most common cause of cancer-related death in men and the second most common in women, is responsible for 1.3 million deaths in 1 year worldwide. Can you believe this? I can't. Actually, I can. Anyway, the most common symptoms are shortness of breath, coughing, including coughing up blood, and weight loss. Anyway, that's all I have to say about the primary lung diseases here, and which I think are the worst types of lung diseases. Back to you, Arnold Schwarzenegger.
Thank you, Dr. Rodriguez.
This and many other reasons are why I want to ban the cigarette smoking in California and also the selling of tobacco, because it brings these many horrible lung diseases to many people's lives. So now you know what I mean when I say stop smoking if you want to live. Well, I guess now we know who the real Terminator is. Cigarettes, isn't that right, Arnold Schwarzenegger? That was not funny. Alright, well, thanks for watching, America, and goodbye.